I'll just start out by saying nationally, over half of states now, I think 24, maybe 25, are on what's being called red alert, which means that the acceleration of deaths and hospitalizations is of enough concern that significant measures need to be adopted and or continued or ramped up if they're not really being adhered to. So the big concern right now is that we are not only seeing sustained new cases in the United States of between 60,000 to 70,000 a day, which is pretty astonishing. We continue to see increases in the death rate in many states. And if you look at the states experiencing increases in death rates, again, it's about 24. So that is not good, but it also is predictable when we think about the trajectory and the cycles that this many small epidemics that are making up the pandemic have taken. So we talked about Memorial Day, we talked about July 4th, yielding a bumper crop of infections that would come out probably anywhere between 10 to 14 days. We have seen that. And then after those infection numbers start to peak as cases, we then start to see an increase in hospitalizations and deaths as the disease in that group of people moves into its later phases. And that's where we are at right now. There are a couple of bright spots on the horizon nationally that I don't want to neglect to mention. There may be some suggestion that Arizona, Texas, and Florida maybe are leveling off in terms of new cases. And I think that that really bears emphasis because I want to come back to that concept of this cycle. One of the questions got to, do you think we'll see an effect of the mask wearing mandate that the governor introduced a couple of weeks ago? And the answer is yes. And so what we're seeing is we kind of keep chasing our tail with this infection. So we see an increase in cases like we started to see in March and April. We shut down. Things start to level off, almost certainly because we have done some significant social distancing, mask wearing, hygiene efforts. And then people start to get a little bit more comfortable and things open up and you start to see a recurrence of these events. Now, our last phase of being open was really all of June and well into July for some places, which is why I think this current phase of disease is so severe. But maybe we're seeing some shifts in those heavily hit states of Texas, Arizona, and Florida that could give us some hope that the measures that those states have taken might be making an effect, which would be really, really good. Here in Alabama, we continue to see well over 1,000 cases reported a day. It's important to note that the number of tests that are done every day, in other words, the denominator of testing, seems to fluctuate a bit. Certainly over the weekend, it's not as reliable. Sometimes there's delays in reportings, but we are consistently seeing over 1,000 cases. That number of cases depends on a lot of factors. So what I and many people like to look at are some other indicators that I know you're aware of, particularly the positivity of the tests that are done. And our positivity percentage has remained at about 18 to 19% across the state for the last 10 days or so. So that is very, very, very high. That means that we have to continue to really be vigilant and keep up our efforts. It's worrisome, especially as we increase testing. When positivity doesn't budge, that means that you're detecting more absolute numbers of cases. So really, really worrisome there. Concomitant with those increases in cases that we have been seeing, where I think above 80,000 cases now in the state, we are also seeing, unfortunately, highs in daily death rates, particularly last week, not so much this week, which I hope is a real indicator, perhaps, of a downturn in deaths, which would be great, and also very, very high rates of hospitalization. Yesterday, we had only 12% of ICU beds in the state of Alabama available, and that is a very worrisome number. Here at UAB, I think you have seen those statistics. We have peaked at around 120 patients with confirmed COVID. Today we're around 116. We have a number of people, usually between 10 and 15, under investigation. So that number is an estimate, but it's clearly in the triple digits, clearly not the way that we want things to be going. Things are stable. We are able to get remdesivir, which is the recommended treatment to people who are here. But I want to comment on the status of remdesivir. It is tenuous. As you may know, it is allocated based on the number of cases and hospitalizations you have through the federal government in a process that has been called not particularly transparent. So we don't really know week to week what number of doses we're going to get. So it's a bit of a scramble, and it's very nerve-wracking for our providers and our physicians and our nurses and our staff to really not know exactly what's going to happen with remdesivir. So far, so good, but I don't want to become sanguine about that because I think it could be a problem, especially if other states and we don't start to see a turnaround in the number of people who are hospitalized. Remember, you can only use remdesivir in hospitalized patients. It requires intravenous or IV administration. So that's where we're at. I think where we're at. The big news, and the other thing I'll mention about Alabama is that virtually all counties now are reporting new cases. So it used to be that, there were still some random counties floating around the edges that were not seeing cases, but everybody's in now pretty much, which speaks to the diffuseness and penetration of the epidemic in Alabama. The big news today, of course, was the governor's announcement that the mask ordinance would be extended through August, which I think is terrific. I strongly applaud it. I think it's the responsible thing to do. It's the only way. One of those three pillars, remember the 3 W's: wear a mask, wash your hands, and watch your distance. That's just what I try to think of it. It's like a mantra. So that's one of the most fundamental pillars, particularly so that we can keep some businesses open, because none of us, as I've said many times, want to go back to the draconian world of everything being shut down. That would just be very, very, very challenging and potentially life-changing. So I'm really grateful to the governor and Dr. Harris for doing that. The other very interesting and important thing that the governor did was to require masks in young people going to school over the age of 6. I think that's a very progressive recommendation, and the reason for that, for my thinking about that, is that I think it's the only way to keep kids in school and to keep them safe, and particularly to keep schools open if a child is diagnosed with coronavirus. One of the concerns we have had is very much like the baseball teams that's happening now. You have a team that has a positive test, someone has a positive test, they've been in the dugout with everybody there, they've been in a hotel with everybody, and then you pretty much got to shut the team down. That's exactly what the concern is with schools. And the thinking around masks in schools is, if you can do it, that you might be able to carefully, safely, and cautiously keep schools open without furthering transmission of infection in those settings. So I think it's a very, very intelligent decision. As I keep saying to everybody, we are in uncharted territory. We're like little kids trying to figure out how to, wade into the ocean. The first time you get in, it gets cold, and then a wave hits you and you freak out and you run back. And that's kind of what we're doing. We're progressively trying to figure out how to swim in this new world, and it's really, really challenging. So I guess the last thing I'll just mention is vaccines. People are almost certainly interested in that. This Monday, we had the first enrollee in the first vaccine to be tested for COVID-19, or SARS-CoV-2, the virus, which is the Moderna vaccine, and that's very exciting. We anticipate that UAB will be starting in a vaccine trial for another vaccine, the AstraZeneca vaccine, probably in early August, and we'll certainly have many more details on that as that date approaches and as it gets more firm.